Hello, everyone. Good afternoon. Thank you for joining us. I'm Melinda Bikini, the Director of Advocacy with the Cholangiocarcinoma Foundation. And this afternoon, we are happy to present to you a couple presentations about how our patients will be able to obtain second opinions remotely if needed. So join us. We are going to hear first from Michelle Trachtman. She's with the Mike Shane Memorial Fund. And then we will hear from Cecilia Monge from the National Cancer Institute. And so I'm going to turn it over to Michelle. She's going to do a presentation, and then when she's done, Cecilia will do hers, and then we will open it up for Q&A. So if you have any questions, please feel free to type them into the Q&A box or the chat at the bottom of your screen, and we will answer them at the end. So Michelle, go ahead. Thank you for coming, and I'll turn it over to you.
Great. Thanks, Melinda. Thanks for having me back again. I very much enjoyed being able to have the opportunity to speak to the cholangiocarcinoma. You have been great advocacy partners for us. So the Mike Shane Memorial Fund actually turns 1 today. This is our 1-year anniversary. And we started the Mike Shane Memorial Fund for Mike Shane, who was a very good friend of ours, who went in, had a well visit, and came out with cholangiocarcinoma, and unfortunately passed away about 16 months later. And he was just a really good friend. He was a mentor to my husband. They were colleagues in business for a very long time, and we decided we needed to find a way to honor him. And because he had had a second opinion, and we knew so many other people who had gone for second opinions for various things, you know, over the years, we decided that was going to be the area that we were going to do all of our work. So we are a 100% donor-funded organization. 100% of the money that is raised does come directly to any grant that we do. We are all volunteers. So, you know, you can feel free to give us money and know that it's going directly to a remote second opinion. We are, have been from the beginning, let me start there, have been from the beginning partnered with Memorial Sloan Kettering Cancer Center in New York City. So they were our first hospital that was willing to partner with us. And in the last 2 months, we have partnered also with the Cleveland Clinic, as well as with University of California, San Francisco. So we can now offer 3 different locations for remote second opinions. We are also in the process of talking to other hospitals across the country, hoping to partner with them as well, so that we have a nice you know, variety of hospitals in different locations. Even though our work is all done remotely, it'd be nice to be able to have people be able to follow up with their doctors after their second opinion, should they choose to, in an area that is closer to their homes. So to get a second opinion with us, it's really a very simple process. We have 3 general criteria that you need to pass through, which is 1, a primary diagnosis of cholangiocarcinoma. You need to be a US citizen right now. We are working on opening up to Canada, but we have not quite finished that process yet, and hopefully at some point be international, but right now we are just in the US. And the other big one, because of our partners' request, and I think because it makes sense, we cannot have anybody be a patient in a hospital at the time of the remote second opinion, because we cannot get any of your medical records. And when I say we, I don't mean me and the foundation. We are not doctors. We handle everything through our medical partners. So if you are a patient with cholangiocarcinoma, or you know somebody who's got cholangiocarcinoma and you want to go ahead and get them a second opinion, you can go to our website. And on our website, we have Patients Apply Here page, and you can fill out a very simple form. It will come to us. And then if you meet our criteria, we will then respond with a letter of welcome, as well as a patient form that is a little bit more detailed. And that also includes the list of hospitals that we can offer for your remote second opinion, and you can choose which one you would like to go to. Upon response of that, we have just a patient service agreement that will go out that we need signed, and then we hand everything off to the hospitals. And from there, our only interaction is we pay the bill at the end. So the hospitals will do all of the gathering of any of your medical records, your scans, your pathology reports, your blood work, whatever it is that they need to do this second opinion. They will provide it to one of their experts. We are only working with hospitals that have expertise in cholangiocarcinoma. So you can rest assured that when you do get a remote second opinion, it will be from somebody who is very familiar with this disease. And at the end, you will get a written report that will be sent to you, most likely via email if you have email. You can apply for somebody who is not the patient. So if you're a spouse or a child or adult child, you know, or a friend or whatever, you can apply as long as you let us know who the point of contact is. We can then work with that person to facilitate the remote second opinion. We've been able to get remote second opinion reports written usually within 2 weeks, and that's 2 weeks after all the data collection has been accomplished. So sometimes you know, we say 2 weeks, but it will take a little bit longer than that. You will never get a bill from us or from a hospital. We pay for the remote second opinion. We will not cover any additional testing or scans or, you know, pathology reports or anything that has to get done post the second opinion, should this second opinion be different than the original opinion that you got. So there's no travel involved with us. You just, you know, send us via our website and then we will do the rest for you. So that's really the very basis of what we do. It's a simple process. We've to date had 7 patients go through the process in our first year, and we're very proud of that. We have a lot of our recommendations come from the Cholangiocarcinoma Foundation, so that partnership has been very valuable to us. And we are, like I said, reaching out to other hospitals and other advocacy organizations and just trying to really spread the word. We've recently completed 2 videos that are FAQ videos. So a lot of the questions that I get asked are, you know, are answered on the Facebook page. We had one go up last week, and there'll be one going up next week. It was just completed this morning. So that's really us in a nutshell. We are very, very easy. It's not a difficult process. And, you know, our goal is only to help patients. And, you know, the more patients we get to help, the, you know, the happier we are. So that's really who we are. You know, if there are any other questions that, you know, people have, I'm happy to answer those. You know, our website is pretty comprehensive and very easy to navigate. And the website is www.mikeshanefund.org. And you can go there and take a look. And if you have questions even after this video is done, we can you can always email me and reach out, and I'll be happy to answer anything, you know, in addition.
That sounds good, Michelle. I'll see if Rick can put the website up on the chat box or the Q&A, and we'll make sure we get that information back out to you. And if anybody has questions, please feel free to put them in the chat box. And we will move on to Dr. Monge from the National Cancer Institute.
Hi, good afternoon. Thank you for joining us. An important thank you to Michelle for everything she just presented and for everything that you and your foundation are doing for patients with biliary tract cancer. And another thank you to Melinda and the Cholangiocarcinoma Foundation, who we partner with on many fronts from the National Cancer Institute side. So I am Cecilia Monge. I'm one of the oncologists on the gastrointestinal malignancies team here at the National Cancer Institute. A lot of our research is focused in biliary tract cancer, and we do a lot of translational work from lab to the clinic. So a lot of early phase clinical trials are going on right now in the National Cancer Institute, and many of them are focused on biliary tract cancer. But I'm not here to talk about our research today. I'm actually here to talk about a second opinion that we are starting to offer to patients with biliary tract cancer. So I'm going to just share a presentation. One second. Okay. Can you see that?
Yes.
Okay. So this exciting new program that we have is called National Cancer Institute Remote Second Opinion Solutions. And from that, we get the shorter name, which is NCI SOS. And basically what this service entails is a service for adult patients from around the country. International patients are also eligible that have been diagnosed with either locally advanced or metastatic biliary tract cancer. And the idea is that they have access to a second opinion here at the National Cancer Institute without them having to travel to Bethesda. The idea of rolling this out right now, because we've had this idea for a while, but we especially think that at this time, many patients with biliary tract cancer and going into the fall, especially in the winter, we think that they may not want to, or it may not be possible to travel here to Bethesda. So we do want to have the option for these patients to have a second opinion from some of the experts in the field that work here. So the entire process is conducted online and it is free of charge. So as was mentioned earlier, the American Cancer Society recommends that if time permits, it is a good idea to seek a second opinion. So those patients that are diagnosed with biliary tract cancer should seek a second opinion if possible. And the reason for that is because it is a very rare cancer, and it is a good idea to have somebody that has expertise specifically in that field to take a look at the case as well. So when should NCI remote SOS be used? Well, the idea is to be able to give this service and this option for a second opinion for patients that aren't being treated in the big cancer centers. Memorial Sloan Kettering, for example, MD Anderson, UCSF are all big cancer centers, and we all actually work very much hand in hand, and the way we approach biliary tract cancer is very similar. So if a patient is already being seen in one of the big cancer centers, it would be best to just continue their care there, because what we're going to give as a second opinion is most likely very similar. So this service is more for patients that are being seen in parts of the country or the world where there isn't that much expertise in biliary tract cancer. Those are the patients that we really want to help, and the physicians that they are being seen by as well. So when should NCI remote SOS be considered? Well, when a patient has some questions or concerns regarding a new biliary tract cancer diagnosis, when the primary team that's seeing the patient is recommending a new treatment plan, if the patient wants to know if there are other treatment options and what they look like, if they want to review alternate treatment plans, especially in the second line setting, including study protocols, we're happy to do that as well. And then we're happy to review the medical management recommendations that the patient already has as well. Through NCI Remote SOS, the goals of the treatment can be discussed. We can discuss the risks and the side effects that are expected with the treatment that the patient is going to get, and if other tests are recommended at this point in time. So specifically, there are some ways now called next generation sequencing, for example, where we can look at the molecular and genetic characteristics of a tumor. And with that, we can see if the tumor will likely respond to targeted agents. So these are new agents that are coming on to basically clinical medicine. And some of them have been approved by the FDA. Others are en route of being approved. So this is an important step that should be looked at in patients with biliary tract cancer. So we're very happy to recommend when that needs to be done. And if the patient doesn't have the possibility of having that done, we're happy to receive the tissue or the slides of the tumor, the biopsy that's been done, and we can do the next generation sequencing here at NCI without any cost. We're also happy just to give general information about biliary tract cancer, since it is a rare cancer, so that the patient has a better basis to be able to establish a productive conversation with the treating teams. We know that oncology teams all over the country are very busy, and sometimes when the patient goes into these meetings or into these visits better prepared or with a bit more knowledge, the conversation may be more productive and the patient may find that they're getting care that they understand better. We definitely want to help patients that right now traveling can be a burden, especially because of coronavirus or because of any other reason. And what is important to say is that this service is not for surgical candidates. So biliary tract cancer patients can be divided into a very big group. So one are those patients that are candidates for surgery, and the surgery is with a curative intent. And the other group is those that are not candidates for surgery. So this second opinion is for patients that are not candidates for surgery. We do need to get some information from the patient before we're able to provide the second opinion. So that includes a complete blood count and liver function tests, as well as we need the imaging to be uploaded to our, there's a website NCI has specifically for that, that's linked to our radiology department, because it is very important in biliary tract cancer cases to look at the imaging, and the imaging is not quite the same as looking at the written report. So we do like to look at the images per se, and there is a link for that. We also asked for the pathology report, and then if there's next generation sequencing already available, we like to take a look at that as well. So to be included in this service, a patient has to have the diagnosis of advanced biliary tract cancer. So with advanced, what's meant is that surgery is not an option. They have to be 18 years or older and be interested in a second opinion. We do need the patients to have a medical oncologist when they reach out to us for a second opinion, because we can't help them from afar otherwise. And then we need them to have access and be able to upload their images. We do take Spanish speakers as well as English speakers. We do need the patient to have access to some sort of technology to be able to do the video call. So usually a cell phone, a tablet, or a computer. Exclusion criteria, as I mentioned, surgical candidates. And this is what the second opinion flow looks like. So basically the patient seeks a second opinion online, and we're going to have this option on our website starting next week. And then the Cholangiocarcinoma Foundation has kindly also given us the possibility of you being able to reach out to us through them. So when that first step is done, then we ask for some labs and the imaging that I just spoke about. And when we receive that, then it takes us between 5 and 7 working days to be able to set up the call and give that second opinion. After the second opinion video call is done, then we send the patient who called us a small summary, and then we have a follow-up call 6 to 8 weeks later, because we just really want to see how the patients are doing, if there's anything else we can help them with, and how the treatment that either we recommended or was chosen in the end is playing out for them. So this is some of the data that we collect when we're looking for a second, when patients call us for a second opinion. So it's very straightforward: name, date of birth, age, where the patient lives, and where the patient is being treated. We also look at some of the history, and the aim of looking at some of the history in the patients that seek out a second opinion is basically we're just looking for risk factors that we know are associated with biliary tract cancer, which are listed here, including chronic liver disease, primary sclerosing cholangitis, and some genetic conditions. Probably the most well-known is Lynch syndrome. We also collect the date of diagnosis, what the presenting symptoms were, and then what type of biliary tract cancer it is. So there's 3 or 4 different types of biliary tract cancer. So sometimes the second opinion varies according to what type of biliary tract cancer the patient has. So we're interested in that. And then we look at current symptoms, at the performance status, what the treatment has been so far, if the patient has received first-line chemotherapy or not, and what the second-line treatment and treatment plan going forward is. So we look at all this to be able to better give the second opinion. So if a patient has a lot of symptoms, there are some treatments that will not work for them in the best way. And then the final results of the second opinion is we look at if the current treatment that was recommended by the treating oncologist is what's done going forward, or if there's another standard of care treatment option that we recommend at NCI that's done, including clinical trials. And with that, I would like to thank everybody that's listening, and we look forward to helping any of you or your dear ones with second opinions here at the National Cancer Institute.
Perfect. So if patients wanted to get a hold of you, how would they do that to receive a second opinion?
So we're going to have the way to contact us on our website. So the NCI Gastrointestinal Malignancies website, that will be up and running next week. And then I believe we're going to also try to do it through your foundation, but I'm also happy to send Rick my email right now, and we can just send it out to whoever's listening, and they can email me directly while those those options come up on the websites.
Awesome. Okay. So Rick, we have one question.
Yep, 1 second. Let me, Lisa Crane, hold on 1 second. Lisa, are you there?
I'm here.
All right, what's your question?
My question is that with the NCI remote SOS question service, you had said that if the patient was determined a non-surgical candidate, and sometimes what we run into as we're mentoring patients and helping them is that maybe a general oncologist has told them that they're not a surgical candidate, and we've seen over the years that then when they get to a second opinion, they actually are a surgical candidate. So can you define a little more about what determines if they're not a surgical candidate? Is that just basically saying they've seen an oncologist and the oncologist said they were not a surgical candidate?
Right, so that's what we mean, but that's also the reason why we want to look at the imaging, because if the patient is a surgical candidate, we can definitely help them with that. So if somebody has been told that they're not a surgical candidate and they have a doubt in their mind, or they would like a second opinion about that specifically, we can do that as well, of course.
Great.
But in general, it's more aimed to give second opinions about systemic therapy, but we're happy to help with and if anybody has that specific question. There, we really wouldn't be giving a second opinion about systemic treatment, but we could give them a second opinion if we think that this tumor could be surgically excised or not. We're happy to do that.
Great, thank you very much.
Okay. Any other questions you see, Rick?
Not yet.
If anyone has any questions, you can either raise your hand or type it in.
Roz has a question.
All right.
Roz, are you there?
Yeah, had to unmute. If our records are in Citizen, do you have, or can we enable you to have access to that, or do we need to still send you all the additional information?
So that's a good question, Roz, and I asked that as well. And we're going to do a test to see if they can accept it that way. We're hoping that it's possible for both options, for both Michelle and for the NCI, because if patients are already uploading their records to Citizen, it's all right there, and that's the whole purpose of it being convenient. So we'll definitely let you know as soon as we find out.
Okay, thank you.
Good question. So Michelle, I just wanted to ask you again, there are no financial factors that go into people getting a second opinion, and they just have to go sign up and a done deal, right?
That's absolutely right. When we did start, we thought about having some financial restrictions, but then we started thinking about how people who are going through this kind of cancer have enough things on their plate, and a financial restriction was not worth it for us. So no financial restrictions. Whoever needs one can apply, and then we will pass it on to our partners. Absolutely.
Okay. And then Cecilia, back to you. I'm really super excited about the opportunities for international patients to be able to get a remote second opinion, because we hear from them a lot. How does that work? Is that going to be any different? You said that you'll do it by phone call, and
so the only difference is just because this is a new service that we're giving to biliary tract cancer patients. The only difference between patients in the United States and outside of the United States is because of some restrictions that we have that we're trying to work around. For now, the international patients, what we'll do is a phone call. For that matter, as I just presented, that will be 2 phone calls or more if needed. But we can't do a video call, and we're trying to work around that. And I think that in the next month or 2 months, it will be approved by the IRB of this institution. But in the meantime, if they are international patients, we will do a phone call and not a video call.
okay. So one question, will our present oncologist know we are seeking this second opinion? Either one of you or both of you.
Okay. Yeah. So the service is really for patients that want to reach out to us, but we are happy if any oncologist wants to talk about the patient with us. We are open to talking to them, of course, at any time. And if the patient would like to take the short summary that we give them to their oncologist, that's something that we're happy that they do.
But they don't necessarily have to tell their patient or their current oncologist that they're seeking a second opinion?
Well, the service is really for the patient. So I think that whatever they're comfortable with is fine with us. We really just want biliary tract cancer patients to have the opportunity of having a second opinion. We understand that we're living through a public health crisis. We don't know what the fall and the winter is going to look like, and we just want to be here for them and for them to have that option. So I think if they have reasons why they don't want to share with their oncologist that they're getting a second opinion, I think that's something that we probably will not be even talking about unless they want to talk about it.
Okay. Same goes for you, Michelle, that you don't
Absolutely.
really have that interaction as well, right?
No, absolutely. I was just going to say ditto to that for us as well. Yep.
Okay, that is wonderful. Any other questions out there? We've got several minutes. We did good with time. That's awesome. So Michelle, again, you want to repeat, you guys are doing second opinions with MSK, Cleveland Clinic, and UCSF right now.
Right now, yes. But we're in conversation with 4 other hospitals currently across the country, and hopefully we'll be able to even expand on that. You know, each hospital has their own sort of legal logistical things that we have to work through in order to get this thing to happen. From my standpoint, it's like, all I want to do is give you money. Why don't you want to just take my money? But there are, of course, all of the other logistics that have to be handled. So it takes a little bit of time, but we are working through the process. Not everybody has access to being able to do remote second opinions at this point. So, you know, we're plodding along, and we're trying to reach out to as many hospitals as possible.
And then at NCI, you are targeting more the community oncology setting, the rural patients who don't have access to the bigger institutions.
Yes, we think that, you know, all the hospitals that were just mentioned, obviously they have a lot of expertise. A second opinion given by any of those hospitals will be very similar to what we say as well. The research is out there. You know, all of us publish, and all of us are in continuous, now more virtual than in person, but before we would see each other every couple of months at meetings. So really the way we think about biliary tract cancer is very similar. So we would like our service to be more for those patients that don't have access to these big cancer centers, because most likelihood our second opinion will be the same that they're already getting from their primary team, because they are real experts in the field. Okay,
wonderful. So I think Rick put out the website links on the chat boxes, and Michelle and Cecilia, we will both we'll put both of the information out on the website and on our social media so we can get the information out. And if there's any changes, let us know, and we'll get that out there to the patients. And if you guys have any questions, you can reach out to the foundation. Do we have one, Rick?
Yeah, it looks like Roz has another question. Hold on one second.
Awesome.
There you go, Roz. Are you there?
I have to mute. Sorry. To Michelle. So if we are being treated at one of those hospitals that you currently do second opinions with, but we want one from a another large hospital, could we apply?
Yes. As long as you're not currently an inpatient at any hospital, yes, you can absolutely apply.
Okay, thank you.
You're welcome.
That sounds good. I will give it one more 30 seconds for any last minute questions you guys have. Throw them out there. And if you come up with questions later, you can feel free to email me and I can pass it on to Michelle or Cecilia, or email them directly as well. I appreciate you guys so much for doing this for our patients. This is a super big value to them, very much needed. It's, you know, we always encourage second opinions so by experts, and I think this will benefit our community tremendously. So thank you both, and thank you for taking the time to talk to us all about it today. All right.
The invitation.
Yes.
Absolutely. Everyone have a great day.
Thank you. Thank you.
Thank you.
Bye.
Bye-bye.
Bye.